with this event, with our conference and with our work together, we could boost a little bit the process and to encourage the Commission to come up finally with this directive so that the Parliament will be able to cooperate with all of you. All of us here, we have better evidence and we have to be much more committed to push for special attention for this problem in Europe. Now, my plea to all of us is that we should work so that our Parliament, our Commission and Council come out with really adequate proposal. And I'm thinking here for Council recommendation. We won't be able to do our work without you. You are our army.
We have 100 million people within the European Union suffering from musculoskeletal disorders. There isn't a problem because we have adequate legislative provision. It's a nonsense. We all know in this room that it is a nonsense, otherwise we wouldn't be here today.
We ought to be able to make the economic case to government. MSDs affect productivity, affect our society and affect the economy.
We now have to move to a new phase of work, which is really about advocacy and action. And it seems to me that the launch of a coalition of stakeholders who can provide some leadership around this, using a multi-stakeholder approach, is really very important.
One of the reasons that this is the momentum is gathering has been the influence of the Belgian presidency. I think that the efforts that have been put in here are really going to make a substantial difference, and Fit for Workers and work is a major component of what we will be talking about next month.
If you had one measure you could use to work out, to estimate the success of your therapy, work would be probably the one we'd now use. My call for the countries of Europe would be to appreciate that work is one of the most important outcomes for a person with musculoskeletal disease, and that everything should be done to enable that person to work if they wish to do so.
The activities that we will take forward from today are several. We will certainly all be champions for this agenda, so that within our own countries we will be going to our governments, to the major employers, to the trade unions, to the healthcare professionals. We will be advocating for this agenda.
It's terribly important to me to support the Fit for Work coalition, because we've been doing a great deal of work in the UK looking at the importance of work for people who are living with musculoskeletal conditions. We know that work is good for you, so we'll be working with companies like Unilever to look at their work practices and why it is that they understand already that it's important to identify people with musculoskeletal diseases early and provide them the support and help that they need to enable them to remain in work.
And one of the goals that these patients set for themselves is, how can I remain healthy and stay in work? And that's the sort of thing that we need to concentrate on, how we can actually help patients and clinicians achieve that goal for people with these conditions.
We can make grand pronouncements at a macro level, at a wider European level, but unless we're helping people on the ground in countries to adapt our findings and our recommendations to their local situation, then nothing will happen.
The goals of the Fit for Work coalition are really to get as many people as possible to understand that good work is good for health, that being in work is generally very good for your physical and mental health, it's good for society, it's good for the economy.